The World Health Organization has issued a global alert to be on the lookout for mysterious cases of hepatitis occurring in children. The CDC currently investigating 9 cases in children under the age of 6 in Alabama. Dr. Frank McGeorge is here with the latest on what could be responsible and also what parents need to know. Doc?
Yeah, Sandra. So I realize in this age of COVID, people might want to try to leap to the conclusion that it's related, but that actually does not seem to be the situation. Some of the cases have actually been quite severe, particularly in the United Kingdom, where 6 children have required liver transplants. This is the notice from the World Health Organization indicating that 74 cases of hepatitis, which is a serious inflammation of the liver, had been identified in the United Kingdom. Now, importantly, none of them were from any of the hepatitis viruses that we more commonly see, like hepatitis A, B, or C, and currently the exact cause is unknown. A similar severe hepatitis has also been identified in Spain with 3 cases, 12 cases in Israel, and additional cases in Denmark and the Netherlands. Here in the U.S., so far 9 cases have been identified in Alabama. Now, while the exact cause is currently unknown, a leading theory is that it might be due to an adenovirus, which is typically associated with the common cold or even a viral gastroenteritis with vomiting and diarrhea. Up to half of the children in the UK and all of the children in Alabama did test positive for adenovirus. This recently published paper describing 13 cases in Scotland, all but one under 6 years old, theorizes that the adenovirus may be more severely impacting young children who are immunologically naive because of restricted social mixing during the COVID-19 pandemic. Other infections are being investigated, including a possible but less likely link to the virus that causes COVID, particularly the BA.2 strain that is currently dominant in most of the world. Now, currently, there haven't been any cases identified in any other part of the U.S. outside of Alabama, but health officials are on the lookout. Now, some signs of hepatitis in a child include fever, nausea, vomiting, followed by a yellowing of the whites of their eyes or their skin, and extremely dark urine. The bottom line here is, at this point, this is something to be aware of, but nothing to be extremely concerned about.